My name is Roger Oakes. I have a PhD in biochemistry and have been involved in the development of CV247 for some 7 years, predominantly for the development in human medicine. But the drug was originally developed as a treatment for dogs by a veterinary surgeon by the name of John Carter. John first conceived of the idea in the 1970s and early 1980s when he was looking for a treatment for palliative care of cancer in dogs and cats, but mainly in dogs. The results of our clinical trials and indeed our experiences in veterinary practice would suggest that the majority of dogs will derive some benefit from CV247. This will be greater in some and less than others. And indeed some dogs won't have any improvement at all. But certainly my experience talking to owners and some veterinary surgeons is that a number of owners have noticed a marked improvement, particularly with regard to their diet and their quality of life. Improvements which some owners have said have been nothing short of miraculous. CV247 is in fact a combination therapy. It's a combination of 3 commonly available healthcare products, if you like, one of which is based on manganese, the other on copper, and the third ingredient is vitamin C. There is, however, a 4th ingredient which actually takes it into the regime of being a drug, and that is because it also contains sodium salicylate. Sodium salicylate is an anti-inflammatory closely related to aspirin, but possibly has benefits over and above aspirin in so much as it is supposedly less of a gastric irritant. The other 3 components have well-known scientific properties. Vitamin C is probably the most widely used vitamin as an antioxidant in the body. The 2 other components, copper and manganese, and it's the gluconate salt we use of these, by the way, which both are essential elements in certain enzymes which are responsible for reducing the number of free radicals which can circulate in the body and have indeed been associated with the development of cancer. The most well-known of these is known as superoxide dismutase, and as I say, both are essential ingredients in the absence of which there is a much reduced effectiveness in combating cancers. John Carter originally developed CV247 for the treatment of dogs with cancer in his practice. His actual selection of the components for CV247 is still a little bit of a mystery. John, in fact, was quite secretive about the rationale for including particular components he did. And it is only subsequently that we have actually put together a strong scientific rationale for the ones which he did choose. But it is not possible, now that John Carter is no longer with us, to put forward an argument as to why he didn't, for example, include some other ingredients as well. But there's no question that the 4 he has selected are themselves extremely potent and do obviously introduce the benefits to CV247 that might otherwise be absent. I'm not aware of the reason why it was called CV247. I was not involved in the early development of the product, but it has been the subject of a number of patent applications worldwide, and patents have been granted in a number of countries throughout Europe and the rest of the world. One of the great benefits of CV247 is that in all the studies that have been undertaken both in animals and in man, the side effect profile has been remarkably low. And in fact, the only side effects that have been observed have been mild gastric irritation in just a handful of human patients. There has never been a single adverse event reported in any of the animal studies. In order to be able to use CV247, because it has a drug component in it, i.e. sodium salicylate, it does require a prescription. For use in dogs, one would have to go to your veterinary surgeon in order to be able to get one. In man, then in the first instance, if you had an interest, you would need to go and see your GP. Understandably, there is much resistance amongst the medical fraternity to use unproven drugs. And therefore patients may well have to be quite determined to get a prescription. And there are a few specialist doctors who are prepared on a case-by-case basis to consider prescribing CV247, which can then be obtained from our distributor within the UK. But quite clearly that distributor is not able to do so without having a proper prescription. CV247 was originally developed as a liquid. It's a liquid formulation because that in fact is probably slightly easier for animals to take. And indeed that liquid formulation is still one which we make available. However, it does require quite a high volume to be used, particularly in man. It can be as much as 30 mils a day. And subsequently we have now derived a capsular formulation of the combination, and it is very likely that both these formulations will be available. With regard to the use of CV247 in combination with other therapies, there is no scientific rationale as to why it shouldn't be. There is no evidence to suggest that there would be an interaction between the components of CV247 and any commonly used drug. And indeed, in most of our experience in palliative care, all the patients have been on a variety of different drugs without ill effect. However, we need to be able to demonstrate this conclusively in a clinical trial, and that has not yet been undertaken. Quite clearly, there are a number of dog owners who, for whatever reason, don't want to allow their dogs to be subjected to potentially dangerous cytotoxic drugs, even if those would be available for the treatment of their cancers, and they have a perfect right to request alternatives. CV247 is just one of those. There are many available, but they would really need to discuss the ramifications with their own veterinary surgeon. It is very important that you discuss treatment options with your veterinary surgeon. If you have an interest in using CV247, you should bring this to the notice of your vet. Information about it can be derived from the website, and indeed a number of vets may well respond favourably. If they don't, then there are other veterinary surgeons who are prepared to prescribe if they think that that particular animal might derive benefit.